Welcome to the Introduction to the National Incident Management System, or NIMS. The goal of this course is to give hospital planners and leaders a glimpse into what is happening nationally to enhance readiness. No hospital is an island, and for one to function efficiently during an emergency, outside support and coordination will be needed. NIMS provides this support and coordination via a comprehensive national approach to improve emergency response and incident management. This national system impacts the way hospitals prepare for and respond to emergencies. This course introduces the key concepts and principles underlying NIMS, including several components that work together to provide a uniform system for preparedness, response, and recovery. These include incident command and management, emergency preparedness, resource management, as well as communications and information management and supporting technologies. Ongoing management and maintenance of NIMS is the responsibility of the National Integration Center, which will also be discussed. Although the system is continually evolving, much of it is in place now and will be described in this training program. To an outside observer, the multifaceted response to a disaster is a testament to human resolve and self-direction. However, the response is not always as smooth as it appears. Ambulances from miles away respond to offer assistance even when such aid was not requested. They arrive to transport the injured but are unable to communicate with a local jurisdiction because their radios are not compatible. Their offer to transport victims is complicated by their lack of knowledge of local roadways and emergency management protocols. Hospital administrators send out urgent requests for specialized medical assistance. The response from the professional community is often overwhelming. Individuals show up but have no means to support their credentials and are unfamiliar with the hospital's emergency operations plan and the location of its vital resources. Healthcare providers inside the hospital grab valuable medical equipment and supplies and rush to the scene to provide care. Police, fire, and EMS are all on the scene, but technological, political, and management issues prevent a coordinated response. Whose incident management system is in place? Who talks to the media? Whose communication frequency is used? What is the chain of command? Who is in charge? For too long, this well-meaning yet ill-managed emergency response effort was the norm throughout the United States. Multiple large-scale events and devastating natural disasters made it obvious that the status quo could not continue. These events underscored the need for national standards for incident operations, communications, and personnel qualifications. They also reinforced the necessity to standardize the approach to resource management, information management, and supporting technology. In 2003, a presidential directive was issued for the development and administration of the National Incident Management System. The goal of NIMS is to provide a flexible framework and nationwide template to prepare for, prevent, respond to, recover from, and manage domestic incidents, regardless of their nature or complexity. This Homeland Security Presidential Directive 5, or HSPD-5, required all federal departments and agencies to make adoption of NIMS by state, tribal, and local organizations a condition for federal preparedness assistance, such as grants, contracts, and other activities. In addition, HSPD-7 established U.S. policy for enhancing protection of the nation's critical infrastructure and key resources, while HSPD-8 led the initiative to strengthen the country's preparedness to prevent and respond to threatened or actual domestic terrorist attacks, major disasters, and other emergencies. NIMS is based on best practices collected from all levels of responders and integrates this experience into a comprehensive, standardized framework that is applicable across the full spectrum of potential incidents, regardless of cause, size, location, or complexity. It also establishes standardized organizational structures that improve integration among jurisdictions and disciplines. Without a doubt, NIMS is far-reaching and comprehensive. While the NIMS concepts and philosophies may seem foreign to you now, Because of their universal acceptance, they will soon become an integral part of your emergency preparedness efforts. NIMS will assist you in every facet of disaster planning. Instead of trying to invent a new system to manage resources during an emergency, hospitals can now incorporate the NIMS resource management system. Education departments will no longer need to create their own disaster training programs. Instead, they will use the curriculums developed and credentialed through NIMS. Standardization, interoperability, cooperation, and flexibility are the cornerstones of NIMS. NIMS is also integral to the National Response Framework, which establishes the country's comprehensive, all-hazards approach to domestic incident response. The NRF builds upon the NIMS coordinating structures to align key roles and responsibilities across the nation, linking all levels of government, non-governmental organizations, and the private sector. It also provides the structure and mechanisms to ensure effective federal support of state, tribal, and local related activities. A basic premise of both NIMS and the National Response Framework is that incidents typically are managed at the local level first, and that these jurisdictions must retain command, control, and authority over response activities. The development and implementation of NIMS is the responsibility of the National Integration Center. This center was established by the Secretary of Homeland Security to provide strategic direction and oversight of NIMS. It is also tasked with providing ongoing program management and maintenance. Situated in the Federal Emergency Management Agency, the National Integration Center oversees all aspects of NIMS, including the development of compliance criteria and implementation activities at federal, state, and local levels. It provides guidance and support to jurisdictions and response organizations as they adopt the system. For NIMS to be successful, elected and appointed officials must also understand and commit to NIMS in order to better serve their constituents. They can do this by committing to understanding and receiving training on NIMS, participating in exercises, and understanding laws and regulations in their jurisdictions that pertain to emergency management and response. In addition, they can help their constituents by establishing relationships and developing mutual aid agreements and assistance agreements with other jurisdictions, non-governmental agencies, and the private sector as appropriate. Mutual aid agreements and assistance agreements provide a mechanism to quickly obtain emergency assistance in the form of personnel, equipment, materials, and other associated services. Incident Command and Management is the most developed and widely used NIMS component. Ambiguous command system structures and unclear lines of authority have been the greatest contributors to poorly organized responses. To enhance incident command and management, the coordination of resources, and the sharing of information, NIMS employs three key organizational systems: the Incident Command System for incident management, the Multi-Agency Coordination System for the tracking and logistical management of resources, and the Public Information System for communicating event-specific information to the public. Command is the act of directing, ordering, or controlling by virtue of explicit statutory, regulatory, or delegated authority at the field level. Coordination is the process of providing support to the command structure and may include incident prioritization, critical resource allocation, communications systems integration, and information exchange. As discussed in a previous course, the Incident Command System, or ICS, is a standardized all-hazard management tool that enables hospitals and other response agencies to organize resources, staff, and facilities to maintain better control during events that fall outside the norm. ICS is based on best practices and proven management tools that contribute to the strength and efficiency of the overall system. With NIMS, there is now only one incident command system that everyone will use. The widely known Hospital Incident Command System, or HICS, is a hospital-specific adaptation of the NIMS, ICS. It is not a replacement of it. While ICS has proven itself to be effective for incident management, other types of coordination and management may be necessary for larger and more complex incidents. This is especially true when numerous response agencies are involved, resource needs exceed local availability, or when the magnitude of the incident evolves and becomes more demanding over time. In these circumstances, incident command would progress into either a unified command or an area command, while the multi-agency coordination system would manage the resource demands in the expanded area. Unified Command is an application of ICS that allows for various response groups and hospitals to form an overall management team that works together to resolve an incident by determining objectives, strategies, plans, resource allocations, and priorities. As an example, in the case of a major hospital fire, the fire department will respond to manage the blaze. EMS will take action to supervise patient evacuation objectives, and law enforcement will be called upon to oversee security and traffic control. The hospital still maintains responsibility for the safety of staff and patients and the integrity of the environment of care. Representatives from each of these response organizations join hospital leaders in a unified command that jointly analyzes intelligence and establishes a common set of objectives and strategies for a single incident action plan. Unified Command does not change any of the features of ICS. It merely allows all agencies and hospitals with responsibility for the incident to participate jointly in the decision-making process. When an event becomes widespread or numerous incidents occur simultaneously, an area command may be established by the ICS-based organizations in the region to provide global management of the event. It is an organization that oversees the management of multiple incidents handled individually by separate ICS organizations. The area command helps set an overall strategy and priorities and oversees the allocation of critical resources. It is a grouping of the same type of response organizations and is generally used when there are a number of incidents in the same area and of the same type, such as 2 or more hazmat spills or fires. These are usually the kinds of incidents that may compete for the same resources. When incidents are of different types or do not have similar resource demands, they are usually handled as separate incidents or are coordinated through an Emergency Operations Center or EOC. In the event of a large-scale infectious disease outbreak, an area command may be set up by the affected hospitals in the region to manage what commonly becomes a geographically dispersed incident. In this circumstance, each hospital within the affected region would locally manage the impact of the incident on their institution using ICS. The incident commander from each hospital would report to and take direction from the area command, who would be responsible for managing and allocating resources and personnel, movement of patients, and the establishment of alternate care centers. The area command is held accountable for ensuring that incidents are properly managed, objectives are met, and strategies are followed. It is organized in a manner very similar to an ICS structure. All the sections are represented except operations, since that section will be activated only at the incident scenes. If the incidents under the authority of the area command span multiple jurisdictions, such as hospitals, public health, EMS, and emergency management during a major epidemic, a unified area command should be established. This allows each jurisdiction involved to have appropriate representation in the area command. The unified area commander is responsible for the overall direction of the incident management teams assigned to the same incident or to incidents in close proximity. This responsibility includes ensuring that conflicts are resolved, incident objectives are established, and strategies are selected for the use of critical resources. The commander is also responsible for coordinating response and resource needs with government and private organizations. Area commands are particularly relevant to public health emergencies, given that these events are typically not site-specific, not immediately identifiable, geographically dispersed, and evolve over timeframes ranging from days to weeks. Such events as these, as well as acts of biological, chemical, radiological, and nuclear terrorism, call for a coordinated intergovernmental, private sector, and non-governmental organization response with large-scale coordination conducted at a higher jurisdictional level. Complex, wide-scale emergencies of this caliber require robust resource and information management. This is where the second NIMS organizational scheme called the Multi-Agency Coordination System, or MACS, comes in. Like its name implies, MACS helps coordinate assets from the various agencies responding to an incident. It is a combination of resources that are integrated into a common framework for coordinating and supporting incident management. MACS is comprised of key players from the different responding organizations, hospitals, and jurisdictions who have direct incident management responsibilities. MACS is usually based in a large Emergency Operations Center, or EOC, that has been established by local and state-level agencies. The size, staffing, and equipment at an EOC will depend on the size of the jurisdiction, the resources available, and the anticipated incident needs. MACS supports incident management policies and procedures and facilitates logistics and resource tracking. It does not manage the incident. That responsibility remains with the incident commander, who retains overall authority for tactical and operational activities. MACS makes sure that resource allocation decisions are based on incident management priorities and strategies. It organizes and circulates information and ensures that each involved agency provides situation and resource status information. In addition to incident and resource management, information about an emergency event must also be broadcast to the public in a very controlled and professional manner. The public information mission is to get accurate, understandable information to the public in a timely fashion so people can take action to save lives and minimize damage to property. Communications that are perceived to be inaccurate, delayed, or unreliable may have potentially serious consequences that impact the management of an incident. For example, an evacuation order may be ignored, or a shelter-in-place demand may be issued too late to have any effect. The process of information sharing should be standardized based on the lessons learned from countless incidents. The establishment of the third NIMS incident management scheme, called the Public Information System, accomplishes this. This system is designed to manage public information effectively at an incident, regardless of the size and complexity of the situation or the number of entities involved in the response. The Public Information System addresses the role of the Public Information Officer, the operational method used to share information called the Joint Information System, and the location where the release of information takes place, which is called the Joint Information Center. Under ICS, the position responsible for communicating with the public is the Public Information Officer, or PIO. The PIO is a member of the command staff who advises the incident command on all public information matters. This includes all media and public inquiries, emergency public information and warnings, and the scrutinizing of media reports for accuracy. The PIO establishes and operates within the parameters established by the Incident Command for the Joint Information System. The Joint Information System is the method of operating during an incident that allows the hospital PIO, for example, to coordinate information with PIOs from other jurisdictions and integrate messages to avoid confusing the public. It includes plans, protocols, and structures used to provide information to the public. The PIO, using the Joint Information System, ensures that decision-makers and the public are fully informed throughout a domestic incident response. During emergencies, the public may receive information from a variety of sources. Part of the PIO's job is to ensure that the information that the public receives is accurate, coordinated, timely, and easy to understand. One way to ensure the coordination of public information from multiple jurisdictions is by establishing a Joint Information Center, which is the responsibility of the incident commander. The Joint Information Center is the physical location where public information staff involved in incident management activities can work side by side to perform critical emergency information, crisis communications, and public affairs functions. In the case of a unified command, those contributing to joint public information management, such as the hospital PIO, do not lose their individual identities or responsibilities. Rather, each entity contributes to the overall unified message. The Joint Information Center should be established in a central location where information can be coordinated across jurisdictions and among all responding agencies and organizations. Although a single location is ideal, the Joint Information System should be flexible enough to accommodate multiple Joint Information Centers when the circumstances dictate. All Joint Information Centers must communicate and coordinate with each other on an ongoing basis using established protocols. A typical Joint Information Center organization includes research, media, and logistic teams. A jurisdictional press secretary and liaison are commonly used. Preparedness is critical to emergency management and is the second key component of NIMS. It encompasses all of the actions required to establish and sustain incident management operations. Preparedness is accomplished through a continual cycle of planning, training and equipping, exercising and evaluating, and taking action to correct and mitigate. Preparedness is the responsibility of every hospital and jurisdiction. Typically, there is considerable variation in the way stakeholders approach each phase of the preparedness cycle. This variation makes interoperable response more difficult. Using NIMS as a basis, all preparedness stakeholders will now be able to attain and sustain the level of readiness necessary to respond to the range of domestic incidents facing the country. National-level preparedness standards related to NIMS will be maintained and managed through the National Integration Center. One of the goals of NIMS is to develop and provide tools to help ensure and enhance preparedness. In general, these tools will include preparedness organizations and programs that provide or establish processes for planning, training, and exercising, personnel qualification and certification, equipment certification, mutual aid agreements, and publication management. Preparedness organizations represent a wide variety of committees and groups that meet regularly to coordinate and focus preparedness activities. In a hospital, this responsibility typically falls under the auspices of the Disaster or Emergency Management Committee. This committee should follow NIMS standards and ensure that their various plans, protocols, and activities are integrated and coordinated with outside jurisdictions. They must establish guidelines, procedures, and priorities for resources and other response requirements. Planning represents the operational core of preparedness, and it provides hospitals with the mechanism for setting priorities, integrating outside agencies, establishing communications channels, and for implementing systems to support their activities. While this is a process, not a piece of paper, standardized planning begins with establishing a core group of documents that describe how personnel, equipment, and other resources will be used to support incident management. At a minimum, this includes an emergency operations plan, which describes how a hospital or jurisdiction will respond to emergencies and procedures for performing critical actions during a response. It includes a preparedness plan that describes how training needs will be identified and met and how resources and equipment will be acquired, and a corrective action plan that addresses mitigation activities based on lessons learned. Finally, a recovery plan needs to be developed that describes the necessary actions to facilitate long-term recovery. Hospitals are also responsible for ensuring that their staff is appropriately trained to improve their incident management and response capability. They must participate in realistic exercises and drills to enhance their plans, expand their capabilities, and improve their overall integration and interoperability within the community. These exercises need to contain a mechanism for incorporating corrective actions and lessons learned from incidents into the planning process. The National Integration Center can assist hospitals in meeting these needs by facilitating the development and dissemination of national standards, guidelines, and protocols for incident management training. The center will approve training courses and requirements and orchestrate the use of modeling and simulation in training and exercise programs. Under NIMS, preparedness is based on national standards for qualification and certification of emergency response personnel. Managed by the National Integration Center, standards will help ensure that the participating agencies and organizations' field personnel possess the minimum knowledge, skills, and experience necessary to perform activities safely and effectively. Standards will include training, experience, credentialing, and physical and medical fitness. Personnel who are certified to support interstate incidents will be required to meet national qualification and certification standards. The credentialing process involves an objective evaluation and documentation of an individual's current certification, license, or degree, their training and experience, and their competence or proficiency. In a similar fashion, equipment used in emergency response, such as personal protective equipment, agent detectors, and communication devices, must perform to certain standards, including the capability to be interoperable with equipment used by other jurisdictions. The National Integration Center will facilitate the development and publication of national equipment standards, guidelines, and protocols. It will also review and approve lists of equipment that meet national standards. Mutual aid agreements and emergency management assistance compacts are NIMS preparedness tools that provide the means for one jurisdiction or hospital to help another during an incident. The National Integration Center encourages responding agencies to enter into agreements with other jurisdictions and private and non-governmental organizations, such as cleanup contractors, transportation companies, and the Red Cross. Hospitals are encouraged to take a similar approach. Finally, the National Integration Center is tasked with managing publications dealing with domestic incident management and response. This includes a wide range of publications, from qualification information and training courses to computer programs and best practices. Publication management includes developing naming and numbering conventions, reviewing and certifying publications, and creating methods for publication control. It also includes identifying sources and suppliers for publications and related services, and the management of publication distribution. Resource management is another NIMS component that contributes to a national framework for readiness. It involves the coordination and oversight of supplies, equipment, processes, and systems that provide incident managers with timely and appropriate resources during an incident. Resource managers use established procedures to continuously track resources from mobilization through demobilization. These procedures help identify what and how much are needed, where and when it is needed, and who will be receiving it. They are also responsible for dispatching and deactivating resources during or after an incident. For example, when an incident occurs, personnel with resource management responsibilities continually identify, refine, and validate resource requirements. These requirements are communicated upwards to the incident commander, who may act upon these needs or pass the request on to the local emergency operations center. In some circumstances, resource requests may work their way up to the state or federal level. Standardized resource ordering procedures are used when requests for resources cannot be fulfilled locally. Incident resources mobilize as soon as they are notified through established channels. Once these resources arrive on the scene, they must be formally checked in, tracked, and accounted for through a standardized resource tracking process. During the recovery phase of the incident, resources are rehabilitated, replenished, disposed of, and/or retrograded. Demobilization occurs in an orderly fashion with the return of all resources to their original location and status. Demobilization planning should begin as soon as possible to facilitate accountability of the resources. Finally, appropriate reimbursements must be made and inventory systems are updated to assess the availability of assets provided by jurisdictions. NIMS standardizes the process of resource management by providing a uniform method of identifying, acquiring, and classifying resources, as well as allocating and tracking them through all phases of the incident. Resource typing definitions provide emergency managers with the information they need to request and receive the resources they require during an emergency or disaster. Typed definitions for 120 response resources have been completed and will be continuously updated, revised, and expanded. Resources are classified by category, which refers to function, and kind to include teams, personnel, equipment, and supplies. Certification and credentialing help ensure that all personnel involved in resource management possess a minimum level of training, experience, and fitness to fulfill the task at hand. Effective communication, information management, and supporting technologies are critical aspects of incident management and are key components of NIMS. To help ensure that anyone involved in a response can communicate and share information, standardized communication processes and systems must be in place and followed. In addition, all protocols must require personnel to communicate using plain language in all emergency management and incident response activities. Establishing and maintaining a common operating picture and ensuring accessibility and interoperability are principal goals of communications and information management. Interoperability is the ability of emergency management and response personnel to interact and work well together. It also means that technical emergency communication systems should be the same or linked to those used by the jurisdiction for non-emergency procedures and should interface with national communication standards. A common operating picture allows incident managers at all levels to make effective, consistent, and timely decisions. Integrated systems for communication, information management, and intelligence sharing allow data to be continuously updated during an incident. For this to be accomplished, mutually agreed upon technology and commonly accepted architecture must be in place. NIMS will identify the requirements for a standardized framework and is committed to leveraging the science and necessary supportive technology to improve these capabilities at a lower cost. Technology standards and support are the keys to facilitating interoperability and compatibility of major systems. The days of freelanced, self-directed response, turf battles, resource mismanagement, inoperable communications, training inconsistencies, and the overuse of confusing technical jargon will be over when all stakeholders begin using NIMS. During an incident, it is reasonable to expect that fire personnel can seamlessly communicate with police and the local hospital. When hospital leaders, fire and police chiefs, and city officials gather in a room to manage an emergency, they should be able to share management responsibilities, understand each other's resource capabilities and management needs, and be able to work together unhindered to accomplish the response objectives at hand. A cooperative, efficient, and unified response requires everyone involved to approach planning, training, exercises, and communication in a standardized, flexible manner. The National Incident Management System provides the framework and oversight to make it happen.